million investment to mental health services at the hospitals that I referenced, and the community paramedicine program. These initiatives and announcements today will help to relieve the pressure on our emergency rooms here at Guelph and Wellington as well. And it's vitally important that our healthcare workers have the tools and the supports that they need to continue to do what they do so well, providing excellent, high-quality care to their communities and their patients. So all of this, I always like, to bring it back to patients first, which some might think is just a simple slogan, but every decision that I make as a minister, and I think over time I've been a minister for 2 years, so it's percolated effectively through the ministry as well, and as what I know to the LINs and beyond. Every decision that I make, I try to imagine myself in the footsteps or the position of a patient or client, whether that's somebody in a hospital ER or a home care patient, or someone going to see a specialist or their primary care provider, somebody struggling with a challenge and needing help. And I try to imagine not what program or service we might need, but rather how can we provide the highest quality service to that individual? How can we make their healthcare experience as seamless as possible, to provide that continuity, to make sure everybody's collaborating so that the patient experience is as good as it possibly can be. So that's what I do. It's important for us to build programs and services, but we need to do it constantly imagining or trying to imagine, and for many of us it's not difficult, how we can stitch together a healthcare system and grow it and improve it in a way which truly makes that difference at that level to the patient, the client, their caregiver, their loved ones, the community. And so I hope and I think that that's what we're trying to do here today. And as I started by saying, I have the opportunity and the privilege of making many announcements, but when I make an announcement, when I have the opportunity to speak about mental health services, when we can come together, all of us knowing that there's a lot of work to be done, and much of it is societal, right, in terms of reducing and eliminating the stigma. But it's making sure that we are creating that positive, supportive, inviting environment so individuals and their family members can feel supported and can have the confidence to come forward and get help with those challenges. So I know the exceptional work that's done here in this hospital